Welcome to this explainer. It's pretty amazing when you step back and really think about it. Today, we're exploring how veterinarians demystify some seriously complex physics just to see inside our pets. We're looking at this fascinating intersection of everyday animal care and highly advanced technology. We're going to break down how doctors use everything from high-frequency echoes to literally massive magnetic fields, all to save animal lives. Okay, let's do a quick rundown of our agenda for today. We're going to cover 1. Seeing with sound, 2. Targeting tumors with radiotherapy, 3. Digital X-rays and CT, 4. The magic of magnets, and finally 5. Nuclear medicine and scintigraphy. We've got a lot of ground to cover, so let's dive right in. So this brings up the ultimate veterinarian challenge, right? How exactly do you diagnose a patient who can't speak? In human medicine, a doctor just looks at you and asks, hey, where does it hurt? But obviously an animal can't tell you. The answer to this puzzle lies in bypassing words entirely. By using advanced physical energy, veterinarians can essentially look right through the skin and see exactly what the animal can't say.
All right, part 1, seeing with sound, ultrasound mechanics. We're starting our categorical spectrum here with mechanical energy, specifically diagnostic ultrasound waves that operate at frequencies way beyond human hearing, between 1 to 10 megahertz.
Now, how does ultrasound actually work? The heart of ultrasonography relies on something called the piezoelectric effect. Imagine a specialized wand, which vets call a transducer. Inside this wand are these tiny little crystals. When a high-voltage electrical current is zapped into them, those crystals literally vibrate. They change their shape super rapidly to produce those high-frequency sound waves. It is an absolutely incredible conversion of electrical energy into mechanical sound pulses. So how does a literal vibration actually become an image you can see? Well, once those crystals vibrate and send a sound pulse into the animal's body, that sound interacts with the tissues. It gets absorbed, scattered, and most importantly, reflected. When the sound hits an interface, basically a boundary between tissues of different acoustic impedances, it bounces back as an echo. The transducer catches that echo, converts it back into an electrical signal, and then a computer maps it out as a dot on a screen. And the brightness of that dot, that directly correlates to how strong the reflection was. Vets actually have a few different tricks up their sleeves to interpret those returning echoes. You've got B mode, or brightness mode, which gives us that familiar 2D grayscale image of an abdomen. Then there's M mode, which maps motion over time and is absolutely crucial for echocardiography, looking at the heart. A mode is the simplest one, just showing spikes to measure distance, often used for looking at eyes. But my absolute favorite has to be Doppler. Think of the changing pitch of a passing train's siren. That's the Doppler shift. Ultrasound machines use that exact same principle to measure the velocity and the direction of moving blood. How cool is that?
Moving right along to section 2, targeting tumors with radiotherapy, fighting disease with radiation. Let's shift gears into the realm of ionizing radiation. We're not just talking about taking pictures anymore. This is a powerful therapeutic tool used to actively fight cancer. Now, when delivering this radiation, distance is everything, literally. Radiotherapy is usually given in multiple fractionated doses, typically 4 to 5 gray each time, to slowly attack localized solid tumors. And the delivery methods are categorized entirely by how far the energy source is from the tumor. Teletherapy means the radiation source is kept at a distance, using X-ray machines or linear accelerators to shoot a beam into the body. Brachytherapy, on the other hand, gets up close and personal. Radioisotopes are placed directly inside the tumor itself or right on its surface.
Okay, section 3, digital X-rays and CT, visualizing the invisible. Next up, we're going to examine how ionizing radiation is harnessed for extreme diagnostic precision. If you've ever stared at a standard X-ray, you've probably noticed that the ribs, the lungs, and the heart can all sort of overlap, making it super hard to see one specific spot. Tomography completely solves this problem. In a CT scanner, the X-ray tube and the detectors are mounted on a gantry, and they physically rotate in unison all the way around the animal. They take a series of projections from literally every angle, and then a computer uses some really complex math to build a pristine, interference-free anatomical slice. You basically get to look at the body as if it were a loaf of bread, examining one single slice at a time. Now, radiologists actually have their own sort of language for reading these CT slices, and it's all based on attenuation. Attenuation is simply a tissue's capacity to stop X-rays. If a tissue is hyperattenuating, like bone, it stops a lot of X-rays and shows up as a crisp, bright white. But if it's hypoattenuating, like the air and the lungs, it stops very few X-rays and appears dark. By adjusting the window of these gray scales on a computer monitor, a vet can perfectly isolate the bone detail or shift things around to view the soft tissues of the liver with just incredible contrast. Which brings us to Section 4, the magic of magnets. Magnetic resonance imaging. We are abandoning radiation entirely for this one and shifting to a mind-bending technology that relies on incredibly strong magnetic fields. Here is the absolute key to wrapping your head around an MRI. Each atom acts as a tiny bar magnet. So, an animal's body is mostly water, and water obviously contains hydrogen atoms. Because those hydrogen protons have an electrical charge and they spin, every single one of them acts like a microscopic bar magnet. Normally, these are just pointing in totally random directions. But when you place the animal inside the massive magnetic field of an MRI, a small majority of these protons are actually forced to snap to attention and align with the field. The machine then fires a specific radio pulse that knocks them right out of equilibrium. When that radio pulse stops, the protons relax back to their aligned state, and as they do, they release an echo of radio energy. It's wild. So while both CTs and MRIs give us these gorgeous, detailed slices of the body, it's absolutely crucial to understand how different they are. Remember, a CT measures how well tissues block X-rays, their attenuation. But an MRI is basically listening for the radio echo of those relaxing hydrogen atoms, measuring what we call signal intensity. Because MRI relies heavily on water content, tissues with lots of water, like edema or the gray matter of the brain, give off strong signals and appear hyperintense. Structures with very little water, like bones or ligaments, appear quite dark. The soft tissue contrast you get from this is absolutely unparalleled. And finally, Section 5, Nuclear Medicine and Scintigraphy, the inside-out image. We've reached our fifth modality, and honestly, this one is fascinating. With CT and MRI, we're pushing energy into the animal to get our image. But with scintigraphy, the patient actually becomes the source of the image, literally lighting up from the inside out. Veterinarians administer radioactive elements directly into the animal. These are attached to biologic molecules to form radiopharmaceuticals. And because these mimic physiologic substances, they naturally accumulate in specific targeted tissues based on the body's actual chemistry and metabolism. Those radioactive elements then emit gamma rays from inside the patient. A specialized gamma camera sits outside the body, detects those rays, and maps out the physiologic uptake. This lets doctors identify normal versus abnormal tissues based on how the body is actively functioning, not just what it looks like structurally. It's just incredible when you step back and look at the whole shebang. Veterinarians are out there capturing echoes, blocking radiation, spinning protons, and tracking gamma rays, all translated into these digital shades of gray that save animal lives every single day. But it really leaves us wondering, doesn't it? As our understanding of physics deepens and technology continues its relentless evolution, what entirely new physical phenomenon will we harness next to give a voice to the voiceless? Definitely think about that the next time you look at a medical scan. Thanks so much for joining me on this explainer, and hey, keep staying curious.